And welcome back. I'm Mabel Jong, and you're watching Day 1 coverage of the World Healthcare Congress here in Washington, D.C. In our studio right now is Jeff Conklin, who is CEO of Adventist Health Plan. Welcome.
Good afternoon. Thank you.
And tell me a little bit more about this plan.
So Adventist Health Plan is part of Adventist Health, and there are multiple Adventist systems in the nation. We're Adventist Health System West, so California, Oregon, Washington, and Hawaii. And Adventist Health Plan is a very new startup for us. It's an HMO licensed in California to serve Medicaid. Adventist Health is traditionally a hospital system. We have transformed and become a healthcare system as we've partnered with physicians, and now we're looking to move to a health system and take on payer responsibility. So we've added Adventist Health Plan.
Now, what have you learned in the time that you've been on that side of the business?
So I've been doing the Adventist Health Plan role as part of my broader role for about 3 years. We just launched this a few months ago. And what I've learned is the culture, the business, the strategies of a health plan in a health system are a challenge. It's a very important aspect of transforming a company and providing care to populations, but it's a hard change. It's a very different environment than a hospital system.
Did you anticipate that it would be so challenging?
In part, but not enough. And we're still going through it because it's turbulent times.
So why do it if it seems...
It's right for the community.
Okay.
So Medicaid is transforming. 3 years ago in California, there were about 8 million people in Medicaid. And then as part of ACA, now there are over 12 million people in Medicaid in California. In California, we call it Medi-Cal. But that's 50% growth in 3 years.
Wow.
So our hospitals are arrayed in rural counties. Those are places where we have a lot of Medi-Cal.
Yes.
And so it's the right thing to do for our community as part of transforming care.
Okay, so when you're looking at rural communities, does that bring in a whole host of other issues that you need to address?
Yeah, because when you're talking, well, first of all, when you're talking about Medicaid, Medi-Cal, you're talking about communities that have a different need than a traditional. So directionally, if you think about commercial or Medicare Advantage, maybe 70% of the things they need are sort of traditional medical. When you think about Medicaid, probably 70% of things they need are more social behavioral.
Okay.
And so it really changes the medical model. It changes the partnerships that you would form. It pushes you to engage with the community in a different way. And that's what Adventist Health and Adventist Health Plan are all about. So
what kind of partnerships have you had to bring in now that you've gotten to know the communities better, the ones that you're serving?
We're still learning. So what we figured out, so in California, probably 80% of Medi-Cal is managed, and so now you have to partner with health plans. So we've partnered with HealthNet. We're in discussions with Anthem. So that's a partnership. Then we need to partner with our community. So we partner with our physicians in a different way, with FQHCs in a new way, with schools, with churches, with the community in a different way. Because we're all about how we improve health care to that community, but doing it in a new model that's not the traditional medical model.
Any indications that you're on the road to success?
Early support. The health plans are supportive. We're now working to expand into other counties. Things that we talked about at the conference today, things about collaboration, things about collecting data and sharing data and the transparency needed when you share data. One of the things we talked about was it's one thing to get at transparent data, but it's really a journey to look at the data the same way. So a payer may look at the data and talk about what their traditional trend is, right? Their cost. To a provider, trend is not a normal concept. It's about the cost of care in that community. And so you may agree on the data, but now aligning your business and your culture and your strategy around it, that's a journey. And we're having some success, but it's going to be a journey.
Now, on that side of the business now, are you able to negotiate pricing for services, and are you in that area right now?
Yes.
And what is that like?
That's the journey too. So the health plans get paid by the state for the Medicaid population, and then they have a certain, what they call MLR, medical loss ratio. And what we're trying to do as providers is to engage at that level and take on as much risk as we think we can reasonably manage to provide care to that community. And that's the discussion. What's the right amount?
What is the message that you're leaving with attendees at this conference right now?
Collaboration. So everything that I've talked about with Adventist Health Plan is around partnering. How do we partner with payers? How do we partner with providers more than ourselves? Because as I said, this is for folks in the community who need different sorts of care. In one market, we had to master lease beds in a homeless facility because it's about how do you get someone who doesn't have a home, how do you improve their health status? So you can write them a prescription. They're worried about food. All right, so it's about partnering in other ways, partnering with payers, partnering with providers, and then pushing ourselves to partner in the community in ways we hadn't considered before.
Okay.
So that's the message, is it's about transparency, it's about partnering, it's about aligning data and business, and it's about doing it slowly, because while this is a big change, we don't want to rush to do it wrong. We're going to be in those communities for a long time.
So who's setting the bar on what you're doing? The provider folks or you? And how, or do you meeting and you're meeting in somewhere in the middle? And where do you start?
Yeah. We ask for a lot of data. With the HealthNet relationship, we're very proud of that relationship, but it took a year and a half to forge that. So you start with conversation, you start with building trust, finding common ground, and then aligning around the business principles, but it takes time.
All right. Jeff Conklin, thank you so much for your time today.
Thank you very
Really
much.
Appreciate it. And I'm Mabel Jong. Thanks for watching. Stay tuned for more.